Good evening, everyone. Today I'll be presenting a work on transforaminal endoscopy in calcified lumbar discs. So when the calcified lumbar disc comes, the posterior approaches are gold standard, like open discectomies and TLIF, where we can do a more wider decompression and ventral job. And transforaminal endoscopy is questioned, and its effectiveness is still in question, and the literature is still evolving. So we would like to present our experience of 79 cases with the study period from 2013 to 2021. It's a retrospective study design, and the patients coming to us with calcified lumbar disc were explained about the three procedures: microlumbar decompression, fusion, and endoscopy. Only the patient who demanded for endoscopy were taken in. So the inclusion criteria being calcified ventral stenosis with or without soft disc herniations with unilateral bilateral symptoms from L1 to S1 disc spaces. Only subacute, chronic or acute and chronic cases were included. The upper clause with L5S1 types and pure soft disc components were excluded from the study. So calcific annulus or the end plate spurs were confirmed with radiographs, CTs or perioperative observation. With burr and endoscopic osteotomes used to cut the calcified part, and if required, bilateral approaches with burred foraminoplasties were added. All the procedures were done under local anesthesia. The confirmation was visible confirmations during intra-op and the MRI post-op. All were daycare surgeries, and we assessed for VAS, ODI, MACNAB, and patient satisfaction index. The MRC power grade improvement for more than 3 and resumption of 2T assist was considered as successful surgery, and failure of any signs of improvement within first 2 weeks of surgery was considered a failed surgery. So these are the demographic details. 67 of them were males. The average age was 42. The follow-up was at least of 12 months, ranging to 73 months. And the measured disc was L3-4, L4-5, and L5-S1 with one double level case as well. The average OT time was 98. The operative shoots were around 20 in average. 14 cases needed open foraminoplasties, and the VAS reduction was pretty good, ranging from preoperative 8 to postoperative 2. And ODI scores improved from 78 preoperative to 6.28 postoperative, and the mean patient satisfaction index was 1.18. We report of complications. 2 patients had unoccasional more than 2 hours duration of surgery. 5 patients had more than unusual bleeding. Postoperative MRI showed adequate decompression in all the cases except for 3. 1 patient with quad ecmona recovered quickly in vesicular functions, but protracted recovery was seen in leg power, which took 6 months. So MRC power affection was seen in at least 19 patients who improved to at least more than grade 3 in 95% of our cases. MRC recovery when occurred was very quick, by less than 6 weeks in all those recovered. And one patient did not improve in MRC grades. 4 patients had a prodromal seizures, and 3 failed cases which mentioned earlier. 1 underwent MLD and 2 were treated with TLIFs. And we report good to excellent MACNAB outcomes in 96% of our patients. So these are our case examples. This is a case of 37-year-old doctor with L5 radiculopathy right side, presenting with 2 calcified discs on L4-5 and L5-S1. He recovered pretty well post-op. As you can see, the post-op MRI, there is good decompression, and he recovered pretty well with radicular pain. But post 10 days surgery, he had a unoccasional right EHL drop, and we explained him about the open exploration, but he didn't opt for it. So we operated a conservative management, and he was okay within next 7 to 10 days. And this is a interesting case of 25-year-old gentleman with a calcified L3-4 disc with quada equina. As you can see in the radiograph, the bilateral approach was used to decompress and remove the calcific part. In the post-op MRI, you can see the complete CSF flow which is restored. He recovered with vesicular functions, but the leg movement took more than 6 months to recover. This is a case of L1-2 conus with calcific disc presented with bilateral paraplegia, and we were able to do a bilateral decompression. And in the image, you can see the asterisk is the opposite side port, and the ventral is the dura decompressed, and he recovered, and he was able to walk with complete 5/5 power within 6 weeks. And this is our failed case, where you can see a big disc in center with calcified, very calcification, and where it was difficult to put even scope. So we could just do a decompression, and some partial calcification was removed, but patient had a persistent radicular pain, for which we did a MLD later on. So these are the literature. So Kim et al. Reported their cases with interlaminar and transforaminal, and it was good outcomes. And they said that there was residuals in the interlaminar. And even Dabo et al. Compared transforaminal versus interlaminar for the procedures, and they had a good outcome. But they said there are residues with interlaminar. And coming to limitations, it was a retrospective study design, non-randomized, non-continuous, no comparative arms were used. The cost was pretty high for endoscopy and as compared to MLD, so there was some bias with the regarding to cost as well. Females are lesser in our group. And coming to conclusion, transforaminal endoscopic decompression is an effective method and alternative for the regular open discectomies and the TLIFs, and it should be considered as a procedure in consent patients before going for more aggressive fusion procedures. Thank you.